Hi everyone, this is a training video for use of the whiteboard and order entry screens within QuadraMed. I've already logged into the computer, and once you log in, you'll notice that this is your home screen. If you ever get lost and you're accidentally into a patient's chart, you can click the top left-hand corner, which is your home desktop button, and it'll always bring you back to this page. There's a couple of ways to launch the master whiteboard. This is the development environment within QuadraMed, so you don't see it here, but if you are in the main emergency department, you can launch the whiteboard from this screen. There will be a way to launch the whiteboard here. It'll say Master Post Triage Whiteboard. Also, if you're inside a patient's chart, you can also see that that feature is here on the ED Reports and Whiteboard menu. You can click Master Post Triage Whiteboard here. That's the whiteboard that'll be running on the large screen on your team. We're going to pretend that we're on Team 1. I'm going to select it. Within a few seconds, you'll notice that the whiteboard report for your team launches. Our expectation is that you will be running this report on the background on your desktop. So you see I have QuadraMed open here, and my whiteboard is running here. The whiteboard is categorized very much like a standard whiteboard. You have team, which is red team 1, the location of the patient, their medical record number, patient name, age, their emergency severity index, brief chief complaint as entered by the triage nurse, and the usual columns for medication, order entry, radiology, labs, and EKG, the provider, attending, nurse, and vital signs, their total length of stay, and their disposition. Any one of these features that is underlined can be used to sort the screen. So if I want to sort by location, I can do that. If I want to sort by patient name, I can do that. If I want to sort by emergency severity index, I can do that. As well, you'll notice that their medical record number and chief complaints visible on this whiteboard because it's on your desktop. However, the master whiteboard that's displaying on the large 50-inch screen on your team will not display the medical record number or the chief complaint. If you want, you can enter into the patient name. If you click on it, you'll notice it takes you to their triage note. I'm going to select back, look at the triage note for this patient. You can see that it's a more complete triage note. As well, underneath the patient's name, you notice that there's a couple of letters that are highlighted. This one says P and this one says C. These are going to be called the ED alerts, and it's to alert the team that there's a patient with a specific possible diagnosis or isolation on their team. P stands for pneumonia. C stands for contact precautions. We've used the standardized hospital isolation precautions within this menu, so airborne, droplet, contact, is the way we've done it. Age, chief complaint, etc. Now within the medication, radiology, laboratory, and EKG section, you'll notice that there's standard indicators that are present on most whiteboards. The first one is the number of tests ordered, and the second one is number of tests completed. As you'll notice, medications is the only one that has 3 columns. These 3 columns represent stat medications, conditional medications, and given medications. Conditional orders are orders entered by an inpatient team when a patient is assigned to an admission team, however, is physically located in the emergency department. These orders will not be picked up by our nurses. However, it allows them to visualize the conditional orders placed by a team in case there may be a stat order entered in there that they're unaware of. So, for instance, this patient has 2 medications ordered and 0 of them are dispensed. I can click on them and see which those medications are. If I click on the medication itself, it gives me a little bit more information. I can see that both of these orders are scheduled still, they haven't been given. Had the nurse given those 2 medications, these would turn, the red would go away and it would say 2 out of 2. Also for radiology, you can click into the radiology section and see that there's 1 chest x-ray that's been scheduled, hasn't been performed yet. If it had been performed and the result was in place, you could see the result by clicking on the chest x-ray itself, and it would give you the report. Same thing with laboratories. If you click on them and they're all completed, it would show 6 out of 6. You could enter there and notice that you can get your results that way. One feature that's been difficult for us for some time is the phlebotomy order entry. Many times the phlebotomist has not collected your specimen yet because they may be on a lunch break, but you're unaware of it. So if you look on the whiteboard and you notice that the laboratories have not been completed for some time, you may actually enter into the lab menu and notice that these orders are still scheduled. If the phlebotomist has collected your labs, it would show collected here. It's a quick way to let you know whether the phlebotomist has collected your specimens or not. You also notice here that on the whiteboard we have a feature that lets you see the most updated vital signs for the patient. Here they're very categorized in a standard way. It's blood pressure, pulse, respiratory rate, O2 sat, temp, finger stick, and their pain score. By clicking into here, you'll be able to see the latest trend, but you can see that this patient's finger stick is high, so it's being flagged as red and isn't abnormal. The provider columns have colors. This first provider column lets you know that no one has signed up for the patient yet. Once somebody signs up for the patient, the flag goes away, and you will see that both of these are going to remain yellow until somebody writes an initial note. Once somebody writes an initial note, if the resident provider writes an initial note, their board will clear and it'll show a white background similar to this. Once the attending co-signs that note, their yellow flag will also go away and it'll show a white background such as this. However, if the attending writes the initial note, both fields will go blank. That we will show you on a later video for ED documentation. The goal of the whiteboard is to put up flags that let you know that something has not been done yet. As you start to complete those things for a patient, their entire fields should go white. When you put an admission order for the patient, it shows the admitting team here, medicine team 16 North 2. When the patient is assigned a bed by admission or by the admitting office, you'll notice that in the top left-hand corner here, their bed becomes visible. If the bed is clean and the patient is ready to be transferred upstairs, you will notice that the indicator goes green. This allows the nurse to recognize that the patient bed is cleaned and the S-bar can be given to the nurse upstairs. I'm going to go back into QuadraMed and now show you how to use the order entry function for a patient. When I enter a patient's chart, you'll notice that the default desktop now becomes the ED Home view. The ED Home view is where we store all the ED notes, all the ED reports, and an individualized patient tracking report. These features are also shown to you in a different video. As you'll notice on the top left-hand corner here, the patient shortcut menu has also been cleaned up to delete the items that are no longer used in the emergency department. What we're talking about today is order entry, and I'm going to use a test patient to demonstrate that. We're going to go to patient checkout, and we're going to use the order entry feature. Many of you have been using this to order labs and radiology already. However, now you can also use it to enter medications. We will now be completely electronic for any order entry in the emergency department. When you click on order entry, you'll notice that the screen has been changed, and this is actually already active in the emergency department. This order entry screen has been categorized to show you panels, which are combined laboratory and radiology order sets, medication order entry screen, laboratory entry screen, radiology entry screen, EKG entry, orders for the trauma team, as well as chest pain orders. Panels, very briefly, are combined order sets, like I said, and they include basic laboratories and x-rays as well. So for instance, the quick admission panel includes basic labs, a venous blood gas, a chest x-ray, and an EKG. The pneumonia panel, for instance, includes basic labs, blood cultures, chest x-ray, and EKG. You'll get to know what each of these panels includes by using them. As well, we will be developing more complete order sets in the future. I'm going to skip over medications for a second. Laboratory is exactly as it used to be. You can click into laboratory orders, and you'll notice that here's our most common order sets. If you want to order something specifically from one of these subcategory screens like microbiology, you may do so. And as usual, if there's something that you don't see that you want to order, you can always free text type it in the bottom here. I'm going to type in Lyme dash, and you can see that I can enter the order from here as well. Radiology has also been cleaned up. The most common orders are placed here from head to toe, and we are going to be cleaning these up as well and adding a few more before the go-live date. However, if there's something you don't see, again, you can enter into common CTs, you can enter into ultrasound, vascular lab to get your duplex, or again, you can free text here at the bottom. EKGs are ordered like usual, and the rest of these orders are unchanged. The new feature within the order entry screen is, like I said, medication order entry. So you can go into common medications and enter a medication for the patient. You'll notice that the most common 50 medications in the emergency department are listed here. They're listed as generic orders, and they're alphabetized from A to Z. Many of the orders have predefined doses, so you can do one-click order entry for Tylenol, for instance, or one-click entry for a Norco, if you'd like. Common fluid orders are at the bottom. At the top of the medication order entry screen, you'll notice that there's some useful panels for you to use. The pneumonia panel includes the standard antibiotic guidelines for our hospital. These guidelines have been published and are posted within the emergency department, and these order entry screens mimic the suggested guidelines. So if you wanted to enter an antibiotic for a patient with community-acquired pneumonia who has risk factors for Pseudomonas, you can click into the screen and you'll notice that it suggests a couple of options for you. You know, if there's no penicillin allergy or if there's penicillin allergy. You'll notice all the doses within these categories are all stat. If you want to add another antibiotic, you can go into the antibiotic common orders. Most of our common antibiotics are listed here. If you want to order anticoagulation for a patient, you're going to have to use the standardized anticoagulation pathway for the hospital. This is how you get in and you can order that treatment. Some of the other panel options also include things like GI medications and respiratory medications, which give you quick access to order things like a GI cocktail. So I could order some lidocaine, Maalox, some Zofran, and some ranitidine with a few mouse clicks. Respiratory medications allow you to do the same. You can enter single or combined doses of albuterol. For instance, here you could order 3 CombiVent treatments. The first treatment would be stat, the next are scheduled for 15 minutes apart. You also have RSI medications listed here. Again, we'll be building more and more panels into this to make it easier for you to order medications. If there are things that you see that you'd like on these screens, please let us know and we'll try to add them in real time.